welcome to this Women's Day special. Okay, Women's Day, International Women's Day special. So for Health Connection, the idea was basically to understand the challenges and how did you come up with this COVID-19, and especially women, because, for example, Miss Kaur, you are not only a woman, but you're also playing different role in the family and in the community. And the same goes for Jneth, Kiran, and also for Anisha, right? So to begin, I would like to begin with Miss Kaur, because you mentioned about talking to your son from India, right? So as a mother now, I think let's start with being a mother. What do you think? I mean, the biggest challenges were because you were away from one of your children, right?
Yeah.
So can you tell us more about that? As a mother, your experience during
Yeah,
this?
in the life we already saw SARS in 2003, I think.
Yes.
Yeah,
Mhm.
but SARS is, I think, at that time still very hard time, but not bad like COVID.
Mhm.
And when you are separate from your family, that one is more difficult time.
Mhm.
So I think away from him like for 1 week, and then when I come back, I told you, yeah, like the plane is empty. Is maybe that time is only 10 passenger, whole,
Mhm.
whole, and come we take off, and then airport is like nothing. Of course, when I come back, I saw my son like after 20 days, but still I cannot hug him. Yeah,
Oh,
because yeah, you understand.
yeah.
I told him, you need to stay away from me. We come back, first thing, shower, disinfected everything. Yeah, so many friends
Mhm.
call me in India, and they ask me to bring just buy mask. So I bought uh, thousand of masks from there
Mhm.
to give my friend, no matter like uh, whatever. When I come back, many people told me you have, even though 10 masks is nothing that time, but I try to give as many as I can.
Mhm.
So yeah, this is the experience. Come back, and then use, yeah, of course, after 2 or 3 days we come on routine, because
Okay.
what in India, this, like that time is not COVID, that is Chinese virus, and I need come
Mhm.
back to that the place. Yeah.
Mhm.
So but yeah, once we come back, it looks, after a few days, yeah, it's still COVID is there, but at least I'm with my family.
Okay, but as a mother, what was I mean, like, for example, like for now, don't think about your friends. You are the mother only. You have
Yeah,
the
yeah, yeah.
children. So, what was the biggest challenge for you as a mother in that day, like on that during that period, initial period, and even now, because Corona is still around us, right?
Around, yeah.
So,
More challenging is like when you go out from home
mhm.
and come back, you always come back with the, like, oh, is COVID with me? I touch so many things, even though I don't want to touch. But usually, when we go shopping, we go anywhere, it's normal things to touch or something, no matter you use sanitizer. But still, yeah, this kind of things. When come back, a few hours, always few hours is very hard
Mhm.
until uh, you clean yourself, disinfected yourself, and that, yeah, is. And even though not me, even though kids go out,
Mhm.
yeah, for school, uh, like, I don't know that time I'm doing right thing or wrong thing. I keep my kids at home.
Mhm.
Even though shopping, I don't, even though my son is teenager, 20 years old,
Mhm.
daughter is 12 years old, but still I don't let them go out. I
Mhm.
just keep them at home.
Okay, interesting. So how about let's move to Janet. Okay. So what as a I know you were in the UK, and did it happen as soon as you come back from the UK, or like?
So my experience when it happened first,
Mhm.
I was in Hong Kong, but then um, it was on February, and my granddad had just passed away on February 14th,
Mhm.
2019. Um, Not 2019, it was last year,
Mhm.
when the COVID was just starting. And then I wasn't that scared about it. And everyone was panicking. Everyone was saying, it would be better if we go back to Nepal
Mhm.
than stay here, since we had, there was there was like, I think people, we couldn't buy as much mask,
Mhm.
and the price of mask had gone up to $15 per one. So everyone was panicking, and people were thinking to go back to Nepal, and a lot of people went as well. But I had to go since my granddad passed away. So when I was there, it was nothing like that. But once, I mean, it was nothing like that, and after a week,
Mhm.
they the Hong Kong government started stopping all the um all the plane, like from all over the world.
Mhm.
So I had to take the last plane from Nepal to Hong Kong. And after that, the government stopped
Oh.
all the airlines, and there was literally no plane. And I experienced the same thing while coming back. Everything was so empty, and I remember wearing like 3 4 masks
Oi.
on me when I was coming back, and gloves and everything. So it was very scary, because Nepal the plane was very crowded. But in Hong Kong, I thought I was being careful, but over in Hong Kong, when I met other people who came from Korea and other places, they were wearing full PPE. So it kind of panicked me, because that was the first time I saw someone with the whole, this gown thing. I didn't know what it was, and it was very panicking. And after that, like I told you before, I was very scared. I was like, even after doing grocery shopping, I was scared if I'm supposed to like sanitize the how am I supposed to sanitize the vegetables, or am I supposed to take shower every time I go out? Because sometimes I just have to go 7-Eleven, and then, yeah, I take shower like 5 times a day, or
Mhm.
scrub more, or so it was like mentally it was pressure for
Okay.
me.
Mhm.
Yeah.
Okay, so now to Kiran. Yes, we heard about it, but that was pre-recording. Right now, in the post-recording, now we have started recording now. And I just want to focus more on the idea that you mentioned about sharing personal space. So Kiran, can you tell more about that challenge about sharing personal space during that time when you were back in your school? And when you came to Hong Kong, how was it different than sharing the space there with your friend and coming to Hong Kong then?
So it was a complete different journey. Like I never thought it would be like, I was never anticipating it. So when my friend moved in, it was all right. It was like, that the first there was this honeymoon phase,
Mhm.
like, two female friends are staying together and stuff. But slowly, when things started, like, we can't go out. We can only go out for groceries.
Mhm.
And then there was also this time limit. Then we have to come back. Then we are just inside the room the whole day. And first it was okay, but later it started getting too much. And like, when like for me, I was very used to being alone in that room,
Mhm.
because I was staying in that room for like 2 years.
Mhm.
And then when I can't, sometimes you just want to be alone in your space. When I
Yeah.
wasn't able to get that, I was getting very irritated. But I think we dealt. I think workout was one of the way that really, like, distracted me, give me that personal space. um and yeah, it was all right. It wasn't that bad. But when I came back home, because I was quarantined for 14 days,
Mm.
and there's no access to fresh air. So for 14 days, you do not, like, you stay under AC.
Where
That's
was
it.
that?
It's in a hotel.
Okay.
It was in Silka, the Yamate one. But most of the hotels you can't like open windows, and there's just like very tiny room. You can't go out. You
Mm.
can't step out even a little. So it was after 14 days when I came back home, I realized that I used to get really irritated. Like, I it was a very different phase for me. For me, I wasn't. I don't know. I really don't know how to explain that phase,
Mm-hmm.
but it was just not like a good phase there, because I was emotionally struggling a lot because of that quarantine, 14 days quarantine, the change. I came from India to Hong Kong. I was just done with my uni. And even me coming back home, I was coming back after 3 years, and the houses in Hong Kong are small.
Yes.
So, coming back again, sharing your space with someone, it was different. But then, like, you get used to it, and this is the way I've been brought up, so it wasn't so hard, but
Okay.
it was definitely challenging.
Mm-hmm. Interesting. So now I would like to go to the next question. Okay. So again, back to Miss Kaur. So my question is about like when you were having all this like situation going around, where did you where were you looking for the information, but like how to protect yourself? So this question is for all the speakers, but then starting with you, where did you get the information about like what to do during the time of this COVID-19, and what should I do? What is the right thing to do? I know you were panicking, right? But were you looking at some kind of special place for the right information for your health and safety?
Yeah, that is quite interesting. Usually, the information what we find from our colleagues,
Mhm.
from news, only this much.
Okay.
Yeah, and we can read the newspaper.
Mhm.
Yeah,
So it was basically based on your colleagues and the newspaper, right?
yeah, yeah.
But did you try to find out yourself, like for example, on the internet or something like that?
Yeah, of course, we check in internet everything. Yeah,
Mhm. So what was the information like for you?
the information is I can't remember clearly, but yeah, usually they just mention about how we need to, um, especially using mask.
Hmm.
And for us is mask is, we never, even though when we have normal cough, running nose, we seldom use mask.
Hmm.
So mask is also a thing. Wash hand, yeah, wash hand, like take 2 to 3 minutes to wash your hands.
Hmm.
Whatever you uh, buy the grocery, everything you need to wash first and then keep, yeah, like set aside
Hmm.
for a while. I told you that time I was in India.
Hmm.
Even though I came to Hong Kong 5th of February
Hmm.
2020,
Hmm.
very beginning period. But I found some information there, and when I come back to Hong Kong, search internet, watch news, advertising about, yeah. So we information, yeah, we found from there.
Okay, thank you. And for you, Janet?
For me, once I was back, I was because my mom and my dad was still in Nepal.
Mm.
So me and my sister was here. So I had to be the one to take care of her as well. So I had to check everything. Like every 7:30 I would be up on Pearl channel waiting for the news. Because then if it's BBC, then they have live like all the time. So I was like already mentally exhausted. I did not want it to like listen to news all day.
Mm-hmm.
So I would just wait for Pearl Channel News 7:30. If I missed that, I would uh watch again at 11:30, around 11:30 to 45. Yeah. So that was my main source for keeping up with all the news, and then how all the precautions. And then in the middle of, like, there was a government advertisement that they a short video of like showing a precaution of how to take care after you take off your mask, wrap it in a tissue, and then throw it, how you're
Mm-hmm.
supposed to wash your hands and stuff. Basic stuff. I just watched near TV, and then yes, and after that, I think few I had to go to YouTube as well to check how I'm supposed to. I tried making my own sanitizer because the sanitizer in the supermarket was drying my hands out, and my sister was kind of starting to having allergy. So I had like a green tea already in my house, so I had to search like a better way to keep your hand moisturized, and how to still disinfect yourself when we're out.
Mm-hmm.
So yes, I watched some YouTube videos, and at that time I did not look through any government website. I did not know that they had provided information. So my source was only TV, Pro Channel, and YouTube, and just Google.
Okay.
Yeah.
And Kiran, how about you? What were your sources for information?
So I was definitely being very constant with like the websites, but I wouldn't check very often because in between in India, a lot of people died because they were, the migrants.
Mm-hmm.
When they were moving from one place to another, a lot of people died, but they weren't even showing those numbers in the death rate.
Mm-hmm.
So, like in between, it started getting really disturbing, and I kind of felt like no matter which source you go and see, go and check up on, you're not gonna get like exact figures or maybe accurate information.
Mm-hmm.
So for a time period, I stopped caring.
Mm-hmm.
And then when I came back to Hong Kong, I don't stay that constant.
Mm-hmm.
Honestly saying, I don't know if this is a good thing or not, but it doesn't scare me anymore.
Uh-huh.
Like, yeah, I know COVID is there. We have to take precautions and it's dangerous. And I think we all are doing our best,
Mm-hmm.
and being afraid it's not gonna really help us. And honestly saying, I'm not just like, even if I try, it
Mm-hmm.
just doesn't scare me anymore. It's just like, yeah, okay, fine, you exist,
Mm-hmm.
cool, now I'm okay with your existence.
Mm-hmm.
So yeah, now I don't really check up on what's the situation,
Okay.
because it's just like whatever I read in the news, it's all I know. I won't put in extra effort to know like I used to.
But you are taking care of yourself, right? You're not
Yeah,
disobeying.
yeah. Like,
Please.
no, no, no. I'm definitely taking the precautions and everything,
Mm-hmm.
and people around me are taking the precautions.
Mm-hmm.
So yeah.
Okay. How about Anisha, by the way? Yeah, we still have Anisha. Anisha, are you there?
I used to Google
Mm-hmm.
and I also tried to learn about virus,
Mm-hmm.
but there was very minimum uh, information in the
Okay.
website, so
Mm-hmm.
I couldn't find anything much. But
Okay.
I usually use. I didn't see TV for news or anything.
Mm-hmm.
Just just Google
Google.
Google search. Yeah,
Okay. I see.
and
Okay.
I don't even read newspapers.
Mm-hmm.
My only medium to see the information is Google search.
Google search. Okay.
Yes.
And Asesh, how about you? I mean,
Okay.
yeah,
Thanks.
yeah.
For me, it was like I look out for the website.
Hmm.
Like the first website I went to was the WHO, the World Health Organization,
Hmm.
because I I trusted that, I think.
Hmm.
So I look out for the website like uh, WHO, and just looking through the, like, there was a chart, uh, like a live chart.
Hmm.
So I used to follow that,
Hmm.
and there was lots of people dying. So it was a bit worrying. But
Hmm.
in Hong Kong, I think it's pretty safe
Hmm.
compared to other countries. So that's how I try to uh,
Okay.
I try to get information from that kind of sources.
Hmm. But also, as I want, okay, this question is again open for all. So starting with Miss Kaur, maybe you can explain with yes, no, and then you can explain. For example, most of the people are now, especially also on social media like Twitter, Facebook, Instagram, so on. So did you also get those kind of information from there, Miss Kaur? Yes, no, why?
No, no.
Why?
Actually, usually I rely on Pearl channels. My like it's part of my life. No matter is any special thing or something, really watch. I like watching news.
Hmm.
So yeah, maybe I don't
Okay.
know why, but yeah,
Okay, it's all right. It's all
yeah,
right. You don't have to be
uh,
right. I mean, there's no right
yeah,
and wrong
yeah,
in this, but it's
yeah.
your
So
opinion.
I don't know, but yeah, usually
Hmm. Okay. And next, Jneth.
Yeah, same for me. Because I've been growing up in Hong Kong since I was really small, and my dad would always make me watch 7:30 news. No matter where he is, he would give me a call every time. It's almost 7:30. Turn on the channel, whether like, so yeah, I had that habit, and whether I used to watch or not, whatever you do, make sure it's the TV is on, and then you're still hearing whatever you're doing, no matter what you're doing. So that was like how I grew up. So I really trust the
Mhm.
Pearl News channel. So I
Mhm.
would look up to that only. I did not look up any Instagram or anything for the precautions and detail about corona.
Okay. And Kiran?
Yeah, for me as well, like in my household, like we would always watch news every day. Like
Mhm.
my dad, even he made it a compulsory thing that
Mhm.
we will watch news. Other than that, I think on Instagram and Facebook I follow these news channels. News
Okay.
channels.
Mhm.
Yeah. So that's another way, and I feel like they do I can say those sources are trustworthy, maybe because of, like, how old and how reliable we find it. Like, BBC News, whenever BBC say something, you won't question it, because BBC, it's a source that you can rely on.
Mhm.
Other than that, for checking the figures for COVID patients, or like, COVID death rate, I always referred back to government sites.
Mhm.
So yeah, that's all about it.
How about you, Anisha? Did you also check any social media to learn about the happening of Corona, COVID-19?
Social media is Facebook, especially.
Okay. So is there any special reason why did you do that? Or yeah, I mean, because you don't have to be right, but just why? Your opinion. Why did you use Facebook?
Actually, when coronavirus started, everybody was posting. only about coronavirus. So uh, I didn't search, but whenever I open Facebook, then I can see the information
Mhm.
and all the people like sharing some South China morning post
Mhm.
or Dim Sum Daily like that. So yeah, I check the Facebook for
Okay.
coronavirus as well. Yes.
Mhm. Interesting. Okay, super. So thank you. Now, one of the main aim of health connection is also we want to help our community in terms of health literacy. That basically means like how to be able to know and look for the information that is needed for our health, right? And in that sense, what we have found, I mean, personally, myself as well, there is a website of the government of Hong Kong which talks on health, and it provides the information on different diseases in different ethnic minority languages. For example, like in Hindi, Punjabi, I mean, they have a different one even for Punjabi. So it's not only Hindi. So Hindi, Punjabi, Urdu, Nepali, and Bengali, and so on. So Miss Kaur, do you know about this kind of information from the government's website?
Uh, I know like Hong Kong government provided us such kind of services, but honestly, I never used this one.
Okay, but you know this, there is.
Yeah, yeah.
Okay, how about Janet? Kiran, yeah, one by, yeah, you can.
I did not know that.
Mhm,
I did not know, but after I did a volunteering job,
mhm.
then yes, slowly I got to know, but I did
Okay,
not know before then.
okay. And Kiran?
So I'm working in an NGO right now that helps ethnic minority to integrate like with Hong Kong community. So over there we do get these like leaflets
Mm-hmm,
where like it's translated in many different languages.
mm-hmm.
So I have seen the website. I know, yeah, and I got to know through the center through my workplace.
Okay,
So yeah.
okay. So Kiran, you said like you are working with the NGO now, right? So did you have to like, so when you got those information, it was your organization who did that, or it was the health department who gave you those information?
No, the health department give us that information to
Okay,
pass it on to the ethnic minority groups.
okay, I see. So we'll definitely go to these questions regarding like the your works. I mean, all of you guys had this different role to play in the community during this, and some of you are still doing it. I really appreciate these things that you have been doing. So, for example, as I mentioned in the beginning, Jneth has been doing video every evening to update about the situation and the numbers on infection, on mortality, on the death, as well as on the infection. Can you quickly update us with today's update, Tina, Jneth? Sorry.
Hi.
Yes. Yeah. Can you just
Yeah,
quickly update
so
about
today,
today's situation? Yeah, because you have been doing that, and I'm
so today,
really proud of that. Yeah.
no worries, I can report to you personally.
No, to all. I mean,
So today
let's.
we had, okay, oh, yes, to all. We had 9 total corona, and 3 of them were from abroad, one from Philippines, one from Pakistan, and one from Dubai. So 6 of them was local, and out of 6, 4 of them is unlinked,
Mhm.
unlinked cases, and 2 of them were linked with the previous cases. Um, yeah. So the unlinked ones, well, on my information, I have all the address and where they live and where they work and their age as well, so that the people know it. So would you like me to say that as well?
Uh, yes,
I don't
please,
know.
please. It would be. I mean,
Okay.
you don't have to tell all the block and everything, but you can just tell like
Yeah,
Yao
just
Chi
like a
Mong, something.
general
Yeah.
address. So So the first unknown case today is 36-year-old woman. She lives in Yunlong and she works in Tung Chung. And the second case, unlinked case we have today is 48 years old woman. She lives in Shamshepu and she works in Chimsachoy. And the third one is 41-year-old housewife. She lives in Chimsachoy. And the last one is 35-year-old male. He lives in Fanling and he works as a project coordinator in Kuntong. And the total case in Hong Kong has been summed up to 11,900. So it's actually 11,100, but one case is maybe case. It's uncertain. So tomorrow they're gonna confirm it. So till today, 11,900 cases, and the death cases is 201.
Mhm.
And in 24 hours, 7 people has been out of the COVID,
Mhm.
and 193 people are in good condition, but
Mhm.
they're still in Asia Expo, and 15 people are in danger state,
Mhm.
and 13 people are in critical state.
Mhm.
And so that's the COVID news. And till today, now I'm going to talk about the vaccine. So till today, till yesterday, 93,000 people have already been vaccinated.
Okay.
And from tomorrow, the government has so till today it was the 5 priority people who were given the first priority to book for the vaccine.
Mhm.
And now 7 other group of people has been included from
Okay.
today. So those 7 group of people are the people from the catering business, from the transport department, construction worker, and the property management worker, and teachers,
Mhm.
and the people, and the tourism sector people. So
Okay.
it's more people who has to deal with more people in their daily
So
lives.
person to
So they
person.
have been
Mhm.
given, yeah, so they
Okay.
have been given priority now.
Okay.
And yeah, so what they are saying right now is, because there has been 3 cases that who the people who has been vaccinated,
Mhm.
3 people have died so far, but
Okay.
the it hasn't been confirmed, it hasn't been clear, like that they have been died because of the vaccine.
Mhm.
So so the government is saying they're still investigating,
Uh-huh.
and the vaccine program will still run, because because they have been they're they have a chronic illness.
Mhm. So no, I
Yeah,
mean,
so
yeah, I think there's room to talk about vaccine and all in a while. Okay, Tina. I mean, thank you for the update.
yeah,
First thing. Okay, thank you.
no
Thank you.
worries.
Yeah, thank you for the update. And first thing that I would like to also add on is that Charisma, she said she had some problem. I don't know where is she back or not. Let me have a look. Okay, so she is not again. She is gone for a while. Okay, so anyway, now regarding the information that you got or not, right? So Kiran, I want to ask you in particular now, because you working on the front line as well with like other people in the room. You worked, and in a sense that you're also still working in this NGO where you mentioned that you get the information from the Department of Health, and you are like a bridge between the people in the community and to the government. So when you got to distribute this information, how did you do that? I mean, and what was the experience like?
So actually, I really didn't do much. There are other colleagues like people who are in a higher position than me.
Mhm,
I definitely did help them make some informative posters
mhm,
to put up on Facebook to, make them more aware and tell them to take precautions. And also, whenever we were doing program, we made sure like every program we keep reminding them to, like, take the preventions.
mhm.
And yeah.
Okay. So again, did you, okay, now this question is also to other people in the room. I mean, if you want to answer, you can raise your hand. By the way, I think all of you are aware of raising the hand on Zoom, right? Or you just can raise the hand like this. I can see, I mean, those of you whose camera is on. Okay. So I know most of you who have been especially working on the front line. First, I really appreciate you guys. Okay. It has not been easy working on the front line, no matter you are just working on the desk. Okay. Okay. Give me a moment. Yeah. Okay. So we have one of the students from Hong Kong University. She is also going to join. She's a student of Masters of Public Health, and she's one of the students whom I've been supervising from last few months. And she will be coming in, and we'll talk about this again, the other things and all. But right now, the question that I was wanting to ask you is that how many of you can read and write your own mother language? For example, like Nepali is my mother language. Okay, I can see Tina, you're raising a hand. Okay, Miss Kaur, can you read and write? I'm sorry, but then I have to ask this. Can you read and write your own mother language? Just raise up your hand if you can. Okay, Miss Kaur, I can see that. Okay. Anissa, I cannot see your video. Are you raising your hand? Okay, I can see 1, 2, 3. Okay, 4. Okay. Okay, I can see, okay, all of you almost, right? So the reason why I'm asking this one is because in the next coming talk like this, we are going to talk about the health literacy and everything. Okay, but there's also this idea of how, sorry. Yeah, so we are going to talk about how the informations are given in different languages and so on. But people who got the information about COVID-19 in your languages from the Department of Health, uh, how did you find about it? Like, how did you think? What did you think about it? How did you feel about it when you go through it? Your experience on that.
Can you repeat the question again?
Okay, did you find the information on health department's website or the one that Kiran was stating, like, Department of Health was giving all those information in different ethnic minority languages? Did you find it or not? If you had find those information in your language, how did you feel about the language, your understanding and so on, in terms of the COVID? Okay, is that clear?
Okay. Yeah. So can I go first?
Yes, please.
So so like I told you, I did not know about the information, but once I started volunteering, I had given leaflets and I wanted to search more, and I looked up online.
Mhm.
And then the language was totally very high level.
Mhm.
Like the words were, I don't think even like the older people would get those words. I've definitely, because I studied in my country till class 9, so I kind of understood some word, but there was still some words very high level. Like I thought it was all taken to like a Google translation, and then just write the English version and translate it and then copy paste it. So I felt like that because even when I read the sentence, it would not sound,
Mhm.
it would not sound familiar, because I think language is, when you're giving out some language, it's supposed to make you understand, make you familiar. But when I read those leaflets up online in my language, it did not sound that familiar. It sounded more like a translation, like total translation version.
Mm-hmm.
And I think everyone would struggle very much reading those leaflets. So I just gave up on those.
Okay. Okay, Miss Kaur, how about your experience on reading those information?
I never read.
Okay, so you have never read that.
Yeah.
Okay.
I never gone through that.
Okay, so definitely, I mean, we will be having our next talk, I mean, in coming days about the health information in our languages. And I would like to invite you, all of you again, to read that kind of materials and information.
Sure. I can read Hindi and Punjabi.
Okay.
Yeah.
Okay, so we have our students. So I would like to ask her question. Sorry, so see that ask you question, okay? Hello, Sun. Welcome.
Hello, sorry.
No problem, it's okay.
Classes.
Okay, so today we are basically talking about COVID-19 and how the mothers, sisters, or daughters, they try to work during this situation. And we have some people from different community. So all of them are in Hong Kong, but they are from India. Some of them are from Nepal. So we have from different background. Now, since you are also working with us and you are also the student of public health, do you have any question for these women in the room about COVID-19 and yes. But before that, can you introduce yourself quickly?
Okay. Hello, everyone. My name is Sun Yang, and I'm a Hong Kong University student. And I take part in the practicing in the health connection. And I will do some questionnaire among the Hong Kong, Philippine, Hong Kong Newport people. And I'm really concerned about the COVID-19 and the that affect their life. And so what do I have a question that COVID-19, if COVID-19 affects the women's health or affect their such as a pregnant, will they also go to the hospital regularly for the regularly check, or because of the COVID-19 they will decrease the number that go to the hospital?
That's an interesting question. Anyone did you get the question, or like do I need to repeat for others? Yeah, because like Sun Kayang is like, yeah, she wants to know, especially on this special day for your Women's Day, you know, we have like women's health issues, right? Now, because of the different women's health issues, some people, during the other time, we can go to the hospitals or even to the clinics. But now, because of the COVID-19, even if you have not personally, not you, but are there any for your friends or relatives who are women? Have you heard about them, or have you yourself experienced visiting to the hospital or clinics during this COVID-19 situation? Is that the question, right, Sun? That is what I understood. Okay, thank you. So yes, anyone who has the experience or like who has felt like that?
Hello, Dhiraj. I want to share my experience. Yeah, several time, maybe 2 to 3 time, or maybe 5 time. I went to clinic 1 time with my husband, not 2 time with my husband, and 3 to 4 time for myself. Yeah, like clinic in Hong Kong, still so many people there. So sometimes it's more scary to go there. Whatever you visited in hospital, clinic is scary, more scary.
Why are you scary? Can you like why were
yeah, I can see like no social distancing, honestly speaking. I live in Yilong, and then so many people,
Mm-hmm.
No matter young people, very old people, they just come to send the saliva to check up their hand something, and then that things makes you, yeah.
Okay.
So like, yeah, and social distancing, if I say, I can see social distancing in clinics. Sorry, yeah.
So there's no social distance in
No,
clinic.
no social distancing, yeah.
Okay.
In
Mm-hmm. That's interesting. Okay.
usually they wear the mask, everything, but still, yeah, the people, even though the sitting places, they put cross, they put chairs in space,
Mm-hmm.
but when you stand up, there is no distance with between the peoples.
Okay.
Yeah.
Anyone else who wants to share kind of like their experience as a woman going to the hospital, going to the clinic during this time of Corona and feeling of fear or whatever you are feeling? How you are feeling?
Yes. Hello. Uh, I have like two experience during this long period of COVID. At first, I was the one who was sick, and I don't know. I really don't know the exact word what problem I had, but I had a little infection that was, I think one of my intestine was swollen up, and I had a pain, and then because I knew the symptoms of COVID was, stomach pain, and then slowly, well, that was one of the symptoms, and I was also getting fever. So I was really, really scared. And then the night that hit me really, that it got more serious, my symptoms, because I was thinking to go to the hospital next morning and just see in the night if it can be, if it's okay. And but then that same night, it was very hard for me, and I literally got up from my room and I told everyone to just stay in their own room and don't come to my room. I had to get all the food in my room because I was very scared, and I couldn't sleep the whole night. I was panicking whether it was COVID or not. And my parents were still in Nepal, and I was with my sister and my grandma. And my grandma just started like crying because, of course, I knew, like, with the news and stuff, she's always at the back asking me, okay, so what happened. So I had to be the one telling her, old people has to be really careful and young ones has to be really careful. And when I was getting the symptoms, like my tummy was pain and everything and fever, my grandma started crying, and like, she just felt so hopeless, I think, because we did not had our dads with us, and my uncle was not here as well. And she was very worried, and me as well. I was very scared to go to the hospital, thinking, what if I get positive and what would happen since there's no one at home. And but I went to the hospital the next day and I was still like panicking. And then, but in the hospital that day, it was not as busy. So they treated me like a COVID patient because I had the symptoms. So so yeah, they were scared as well. They were like, you have to do the COVID test. We don't know what's wrong yet because they haven't done the x-ray and stuff, but they just knew I had a fever, I had a nausea, I had a stomach pain, but they did not know what the exact source was. So they treated me as a COVID patient, and it made me more scared, And my grandma was outside; she was literally tearing up, and I was like, I was telling myself, why did I go out yesterday? Like, where did I went wrong? I was thinking all of that, and I was treated as a COVID patient, and after that, in 1 hour, the result came very quickly because I had to be admitted. So they did like a quick, I don't know, quick checkup. So the result came, and then finally I was negative. And then in the hospital, they told me, like, because I had to stay over a week, so they told me in 4 days you have to do the COVID test again. And I did it again. And then so that was my first experience as a personal experience. And the second experience was my grandma. I had to, because she has like a ear problem, so we have to get her checkup. Like, she wants to get a checkup every once in 3 months. So whether it hurts or not, she would just want to get checkup. But this time during this COVID, it was very unusual, because I was like, it's your checkup time. And she would just hesitate. She would be very scared. She would be like, I don't think there's any problem. Let's just not go this time and wait after a few months more. So yeah, it was very like a hesitant for her to visit the hospital. Being an old lady, she was like more scared to even go out, to be in the crowd. And even to take my sister out, she would be very careful. But yeah, that was like a experience.
Okay, so before anyone has to share, let me introduce our Health Connection team member, Monica. She is a registered nurse here in Hong Kong, as well as she is a health manager for Health Connection. So welcome to the talk, Monica. So on today's webinar, we are talking about women's health, but also more on health. We are particularly focusing on COVID-19 and the challenges. So Monica, can you share your experience with us, like, because you work as a frontline person as well? How has it been your experience working during this time? But before then, I would like to, like, yeah, please introduce yourself as well. Can you do that, Monica, quickly?
I'm Monica Limbu, and currently I'm working as a registered nurse in private medical clinic. Yeah, so like in the beginning when the COVID thing started, it was quite difficult for us to, because we like every day we had new protocols and new rules and everything. But now we are getting used to. It was quite a scary situation actually. Yep. But now I think it's getting better.
Okay, so before, yeah, I know, like, we're supposed to spend just an hour, but we also like we are going long. But this we wrap up our everything. Is there, okay, some of us in this room, I know you guys have to work tomorrow and you have to leave early as well. Kiran, for example, are you there? Okay, so yeah, I think Kiran was mentioning about, like, she had to leave early and she is leaving now. Okay, we'll talk with her next time. But those of you who are in the room, you can please tell me about what you want to talk about, especially about related with Corona and being a woman. I mean, how challenging has it been? Because what I understand, in South Asian family, women has so many duties and responsibilities, right? So for example, I'm picking you up, Miss Kaur, once again. So what are the duties you have to do apart from being an educator? You are an educator, but there are other roles that you have different kind of jobs to do as a woman, and how Corona has made it more challenging in those different role of your life.
Yeah, more challenging. Like usually before we have a free time, whatever we want to go out, I can go out. Now we reduce until now, even though now is, I cannot say normal, everything is normal, but better condition. Yeah, once a vaccine is, but yeah, shopping, everything. Yeah, like I really try to do once a week. Yeah. So very short period, even though if need to go for walk or exercise, just try to go morning time or when the less people is outside.
Okay. And how about as
Pressure is maybe less because usually we need to go so many time outside, but now is less.
how about as a mother, you mentioned already, but also how about professionally, you know, while working with the children as a teacher, what kind of challenges did you face?
Because when we work with kids, as a teacher, we know the families, everything, but still sometimes the main challenge is what we need to face, like when they come back, because sometimes not all families is very caring families. Sometimes the parent, some kids we see, they parents, sometimes we feel like when we work, oh, if we touch them or something is happened, then like usually same like other profession.
Okay.
Yeah, but if you are doctor or something, you are different. Yeah, but kids emotionally we need to face, we need to deal with emotion also,
Yeah.
so bit different. Yeah.
Okay.
Yeah.
And how about Shun? How did you feel? I mean, like, you were here in Hong Kong, you are away from your home. So how did you feel to be here in Hong Kong as a student and in this time of Corona?
I think maybe the first experience of our students, the biggest problem is the language problem. Although we are from China, but in Hong Kong, most people speak the Cantonese, but we speak the Mandarin. And I think maybe it's not very easy for us to stay here for seeking a good job and live there for a long time.
Okay.
Yes.
But during the time of Corona, what problems did you face during, like, when the Corona happened? So for you, what was the biggest challenge for you?
Biggest
challenge.
sorry?
Biggest challenge.
Challenge.
Yes.
I think biggest challenge is to maybe is to finish something independently.
Okay.
Yes.
I see. So now things are getting okay as I hear, but also still there are so many things to happen. But I would like to ask Jneth, because she is more strongly working on the front line, in a sense that she had been working as a volunteer, and now also she is doing this everyday reporting. So Jneth, can you explain more about like how can we help you, because you have been working on these issues, so especially on reporting, but I know you are also doing volunteering at the time along with Asesh and other team members of yours. I would like to know how we can help you, not me alone, but my team with Anisha and Monica, and even Sun is now working with Health Connection, and Miss Kaur. How can we help you, Jneth and Ashish?
Hello. So I think when I am, because I've been doing this for over a month now, every single day, and every time tell them the news, like the daily news of what's going on and everything, I'd like to always have like a little health awareness section at the end, so they would know like a simple health awareness, a paragraph or something, so that they are aware. They're like, for example, I would tell them to wear surgical mask instead of any other mask, make sure it's 3-layered, or sometimes I would remind them to sanitize their hands. So I think in that section, I could really use the Health Connections help, where they could give me more information regarding the precaution wise, and more like, because when I do it, I do my research, of course, but even some words I'm not sure what it is. And even if I like try and find the meaning of that, I would really not know. Like, what I'm trying to say is, I mean, I would not know how to take those advices, take
Mhm.
those health advices, and use it on me. So it's very hard for me to
Practice.
tell people.
Mhm.
It's very hard for me to tell people if I'm the one who doesn't know how to do it. Then, like, how can I explain to people properly?
Mhm.
Because even though I just tell the news and let them know, there's so many people that ask me off screen as well, like, so how do we actually do it? And then, is it really 20 seconds you have to do it?
Mhm.
And those are like simple questions, but what I'm trying to say is there's more questions that gets in depth regarding this health issues.
Mhm.
And yeah, I think that's where I would really use your help, and it would really help more people if
Mhm.
yeah.
Okay, thank you. We'll try our best with our team and all. Miss Kaur, is there anything that Health Connection can be of health help for your community, including you and your family?
Yeah, sure. Why not? If you send us any information regarding health,
Mhm.
yeah, regarding health, yeah, it's really helpful.
Okay.
Not just for my family, maybe my community too.
Mhm. But again, as I asked you earlier about the language and so on, for example, right? I'm not able to speak your language in fluently or like read and write. So maybe we have to work together on this idea.
Yeah, sure, sure,
Yeah.
sure.
Yeah. So let's do that thing. But once again, my team members here, Monica and Anisa, do you want to tell anything to the other people in the room about Women's Day, about COVID-19, or even about your health in general?
I don't think I have to say anything because uh, I I learned many things from this meeting today.
Okay, thank you. Even I'm learning many things right now. Asis Bhai, I mean, we don't want to leave you out, okay? I know you are the minority as I am here in the room today, but is there anything that you would like to take away or like tell us how we can help you or how you can help us together?
Like I say, Tina said, most of them because we work together. With,
Mm-hmm.
I work together with Tina, so like most of them she said. But uh, as I'm like a filmmaker, like I do some videos and photo. We can
Mm-hmm.
create some awareness through that. Like we have talked about it.
Yes.
We would like you guys to have more. Like we have like you share us uh the idea about it, so
Mm-hmm.
we would like you to help like find some topic or like like character, so
Mm-hmm.
we can go dive into that and create awareness around ethnic minority, and
Okay.
we want to help up with that.
Okay. Thank you so much. Thank you. So yeah, I mean, it was a good one for it is not the last one. It is the first time we are doing like this. And
Mhm.
I know it is already 11 o'clock in Hong Kong, right? So I don't want to spend more time for tonight. Maybe we'll have definitely other topics in coming days in association with other programs and so on, and also with other communities. Thank you all once again for joining it, and happy Women's Day to all the women in the room. You guys are amazing, and I'm happy to be part of this communication in this conversation as well. So if you have any questions, I mean, later on, I mean, we all are in touch through WhatsApp and other channels. Please be in touch, and let's try to do our best to keep ourselves, our family, and the community happy and healthy. So thank you once again. So before I say goodbye, is there any last question or last thing that anyone wants to speak about, one at a time, please?
Thank you. It was nice to see you, everyone. And I did not know Monica Didi was a nurse, and also I cannot see that mask lagaco.
Anisha.
I cannot see.
So-
Yeah, Anisha.
Mhm.
It's nice to meet you all because like Asesh as me, we started volunteering, but we didn't know much people. And since I only knew Dhiraj Dai, I'm very thankful for him to have me in this conversation, and hopefully I can share more with you and learn from all of you. Nice to meet you, and happy Women's Day.
You're welcome.
Meet you, all of you. Today really learned so many things. And yeah, happy Women's Day.
Thank you, Ms. Kaur.
Well, I just want to say that like I've learned so much thing and the story you guys told me about. So I'm thankful for that, and I'm thankful for Dhiraj Dai inviting me here. And I just want you to all the ladies here want to thank you and happy Women's Day, and just keep safe and be strong. That's it for me.
Anissa, can you once remove your mask and show your face and just say hi to everyone so that they can recognize you when you guys are working together?
Hi.
Okay,
Hi.
that's Anissa. That's Anissa, our media manager. And Monica, do you have anything to share?
Yeah, I'm also glad that I met all of you.
Mhm.
Hopefully we can work together in future.
Definitely.
Yes.
Okay.
And yeah, happy Women's Day.
Thank you. Thank you all. Thank you all for coming in. Okay, so as I told earlier, this is the first time we did, but this is not the last time we're doing. So we're doing more and more of this session. If you are interested in any topic, okay, please let me know, and we will keep on doing this kind of events and help each other to build a happy, healthy community in future.